Why do more people have diabetes? Since 1980, barely 2 generations, the number of people around the world with obesity and diabetes has increased dramatically. In both sexes, every age group, every racial and ethnic group, and all educational levels worldwide. The rates of diabetes are now rising fastest in low and middle income countries. 80% of people with diabetes live in these countries. How did we get here? Obesity, diabetes, and high blood pressure used to mostly affect people in rich countries. Now, low-income countries have these problems too. These diseases come when traditional ways of life change. New foods, new ways of working, and new ways of life change what people eat and how much activity they get. Some changes, like public transportation, make life easier. But modern lifestyles also raise the risk of weight gain, diabetes, and other chronic diseases. People are moving to cities for work and a better life. Instead of eating food that's grown nearby, they now buy prepared food from street vendors or packaged food from stores. These foods taste good. They are fast and easy and often cheap. But these processed and fast foods make it easy for people to gain weight. People also have less activity. Instead of digging and harvesting all day on the land and walking everywhere, many people now work in offices and factories. They sit all day and take public transportation to come and go from home. People are gaining weight, especially around the waist. This comes from eating too much sugar, starch, and fast foods, and getting less activity. These are strong risk factors for diabetes. Another factor is that people are living longer, and diabetes is more common in older ages. People are living to be old enough to get these problems. Some people have a genetic tendency to develop diabetes. If someone in your family has diabetes, you may only need to gain a little weight, especially around your waist, for diabetes to start. Another risk factor are low birth weight babies, which are more common in poor countries. Hormonal changes occur before birth to these small babies who are under so much stress, putting them at greater risk of chronic diseases as adults. No matter what your risk is for diabetes, with awareness and intention, you can change how and what you eat and increase your activity level. You can live a healthier life and avoid most chronic diseases. Remember, new foods and new ways of working raise the risk of obesity and diabetes. Getting more activity and eating healthier can prevent diabetes and most chronic disease.